All right, so welcome back to Countdown to Duberville. We're here at Blackhawk Chiropractor to see my chiropractor, Dr. Tsai, get an adjustment. I come in once a week, if not twice a week when I can. Something I recommend everybody doing. But like I said, come with me inside while we go and get an adjustment. Talk about chiropractic care, why it benefits not just strongman, but anybody in the gym for a better lifestyle. Help your back out. We all have issues with our back. So 4 weeks to go. We're gonna go get adjusted.
Big D!
What's up, Doc?
Me since about 6. How you doing?
6, good, very good. So this week, Countdown to Duberville, we're down to about 4 weeks out from the show. Weekly chiropractor appointment here with Dr. Tsai. So we're gonna do an adjustment, we're gonna talk about chiropractor, and we'll go from there. So one of the questions, and this come up in the other video too with massages, the wife had to bring it up, but I'm definitely a bigger guy, and I'm not even big in terms of strongman. So one of the questions for Dr. Tsai is, you know, am I one of the bigger persons you adjust? You see him adjusting me, I make him work, I make him earn his money. So do you have?
Well, Darren, you're huge. And I will tell you, huge in a muscular, strong way, obviously. But I have actually bigger people, as probably many chiropractors can attest that. I have patients over 400 pounds. The interesting thing is, the bigger you are and the more muscular you are, back up, people have asked me, they'll come in after I see you, or a big guy, and they'll say, hey, was he hard to adjust? The athletes that are big are not really hard to adjust. It's the people that are like severely overweight with body fat that are 400, 450 pounds that are harder to adjust. Well, what's your body fat percentage anyway?
32% right now.
Yeah, that's the average of 2 healthy women.
Thank you. 6'2", 360, 32%. We need to get that down a little bit. Got a little extra. Every time I come in there, I hear about them getting bigger and bigger. And
you are a big, good-looking man.
That's why I come here. All right, so one of the interesting stories that when I first met Dr. Tsai was his story about why he got a chiropractor, and he has a bodybuilding background, 3rd place, Mr. Pittsburgh, he said, Mr.
Yeah, I only competed twice, 3rd place in the novice and the light heavyweight class and the open class, and then I took 3rd place in the Mr. United States competition.
That would have been what, back in the
80? The Pittsburgh was it was the mid 80s, 85, 86, something.
Okay. But if he was to talk about why he started chiropractic a little bit, why he got into it, and why it helped him, and why he continued to help others.
Okay. So when I was competing, I was in college. I also worked a summer job for what would be almost like a federal, like a FedEx job. It was called Emory. And funny thing, I had a pickup that was going to all places, Vatican City. I always say there were probably gold bars in it, and it was about 300 pounds. And they had one guy to go get the shipment, and that was me. They always threw the bigger stuff on me because I was bigger at the time. And so anyway, hurt my back, injured my back. For a 20-year-old, pretty rare. I herniated 2 discs, but they herniated and broke off as well, which is called sequestered. The disc is floating around the tube of the spinal cord. They wanted to do surgery, suffered for about 9 months until someone introduced me to a chiropractor, changed my entire life. The nice thing about that is I had the experience of actual being in pain, horrible sciatic pain, which many of you probably have had in your past if you're lifters, almost like a cattle prod being stuck in your back and going down your leg. The chiropractor took a while. He fixed me up and it changed my entire life. I changed my major at college, and then I went to chiropractic school.
So that's a pretty cool story for someone that, and one of the things I've found too is I've been a chiropractor before. I've had a back issue for years, and we never find it. When we find issues, start fixing it. But the reason I like coming here is that story, because it's someone that's been there, that does what you do. They understand lifting. My other doctors and chiropractors said I shouldn't lift more than 5 pounds, 50 pounds. First time I was here, I go downstairs and I'm deadlifting 600 after getting an adjustment. And I said, Dr. Tsai understands what we do. Maybe it's not the best thing to do, but definitely understands what I do, what most of us do. So it's almost like why chiropractic can help you.
So when I met Darren, he had 2 problems. One, he had a hip injury, and then he also had a pinched sciatic nerve. Darren has a pretty significant spondylosis, spondy of L4. So he tends to pinch his sciatic nerve. It's actually amazing what he's able to do, the extraordinary lifts and events he does, having a spondy the way it looks. Because of that, in my office, he does not get side posture. Most of my patients do. but I do an anterior lumbar adjustment with him with the fabled anteater. The anteater I invented many years ago. It's taught in colleges and sells all over the world. It's for anterior adjustments, saves the hand, and the patient gets a deeper adjustment. So the first thing I'm going to do with Darren is I'm going to come all the way up the spine with an anterior adjustment. So let me have you sit up, make sure you're sitting all the way back, and you are, that's good. And you go ahead and lay back, please. Arms crossed on your chest. Let's scoot you that way a little bit. Very good. Rocking and popping. Okay, so next thing I'm going to do, he's going to get a cervical adjustment. Drop his shoulder a little bit. Same thing here. Turn your head to the left. So I also work on Darren's hips. You go ahead and lay back for me if you would. Scoot this way a little bit so your head's on the bench. Steel tables just for Darren. So a little bit of stretching of the hip, joint mobilization, just audible there, and we're going to give a little tug here. So, and we have one more face now. This chiropractic is what I would say called simple or straight chiropractic. We don't do a lot of fancy stuff here. I know Darren gets cryotherapy and does a massage therapy as well, gets other things done. We pretty much just adjust here.
All right. So just a little bit of chiropractic, you've seen my adjustment stuff there. Obviously I have conditioned, that's why I've been coming here for about a year. Definitely been helping me. But Dr. Tsai can tell you, like, it's something even good if you don't actually have a back issue. Like, why should someone come and do chiropractic if they're doing like strength sports and heavy lifting?
Okay, so there's two different questions there. Why would somebody healthy want to use chiropractic, and then why would a strength athlete want to use chiropractic? So I'll start with the first one. I always say you just don't brush your teeth when they hurt. Chiropractic care is about getting people better, and then preventative care to keep them healthier. Subluxated joints, which means the joint's out of place and locked, not going through its normal range of motion, they break down very quickly. They deteriorate or degenerate, even in a healthy spine. So chiropractic basically unlocks the joint, gets pressure off nerves, and gets you healthier, and helps prevent problems in the future. For a strength athlete, every organ, tissue, cell, everything in your body, muscles, they're all controlled by nerve endings. Your spinal cord sends nerves out to every parts of your body, which are basically just electrical wires. And when the nerves get pinched, the electrical wires lose part of their power. And so your muscles can lose power as well. Well, see, that's the cool thing now. Back in the 80s when I hurt my back, and I'm older now, but this was way, 40 years ago? But back then, the standing theory was bed rest. Now they know that's garbage. I always told them, after I started working out, after I was injured, I had to take time off. But I would go back to the gym, and it actually made me feel somewhat better. And they said, absolutely not. But now we know that's not true. When you get an adjustment, barring any horrible pain, it's best to do some type of workout strengthening to hold the joints in place.
He has a gym downstairs. I train at Brickyard Gym, and the shirt on there. He's let his patients go downstairs and train, and they range from all ages, male, female, all different issues. But recommending his patients actually go and train, lift weights. You don't necessarily do what I'm doing, but why even? I always say if you have a bad back, you need that. If you have bad knees, you need to squat. Doing that kind of stuff helps you recover, helps get the blood flow to it, and it just makes you stronger. So
I started in the martial arts when I was about 11 years old. And then about 15 or 16, my martial arts instructor, I wanted to gain some weight. I asked him to write me up a little weightlifting program. As soon as my hands touched the barbell, just like probably many of you, I just instantly fell in love with it. And I gravitated more to weightlifting than I did martial arts later on. My patients, I tell them, I've been a chiropractic patient since I was 20 years old, but I've exercised since I was a kid. And if I just get chiropractic alone, I feel good. If I get chiropractic but do my workouts and exercise, you feel great. Now, unfortunately, the majority of, average Joes, they don't exercise. And it's a secret that we know that how good lifting is for you, whether it's strongman or bodybuilding or whatever it might be.
Yeah, just any kind of lifting you can do in the gym, like even at home stuff, even body weight stuff. And he said, people are learning more that it's much beneficial. Obviously, we do it, we love it. It's in our blood. You can't stop doing it. But for the average person, just to go out there and lift some type of weight, some kind of workouts, it just makes everything feel healthier and better. All right, so that was our little chiropractor adjustment here at Blackhawk Chiropractor with Dr. Tsai. So I'm down to about 4 weeks from Duberville. I'll be back in for weekly adjustments until I go. I said massages, cryotherapy, chiropractic, everything you do to keep your body. It's more than just in the gym. It's eating right, it's sleeping right. So everybody can tell you that. But just want to say thanks to Dr. Tsai here.
Yeah, and big thing I want to say too, all joking aside, it is an honor having you as a patient. You're not only one of the strongest men in the world, you are so humble, loving guy, beautiful wife.
Thank you,
so
sir.
Congratulations.
Yes, thank you.
You win last year, and good luck in Canada.
All right, so there you have it, my weekly visit to see Dr. Tsai. And I said not only is he a good chiropractor, he's just a great guy. And I said he loves strength sports and everything we do and stuff like that with being a bodybuilding background. So he said we're down to 4 weeks to Duberville, getting ready. It's getting down to crunch time. Hopefully we're going to be ready to go. Next week we're going to do a little stretching and a little bit of yoga maybe. And then we'll do a few more shows as we get closer to the deadline. But like I said, 4 weeks to go. Countdown to Duberville. Godzola out.